In this episode, levels of assistance. This term refers to the language that therapists and members of the healthcare team, including doctors, use when referring to how much assistance a client needs from caregivers. This episode will go over each level, documentation, and some examples. Let's check it out. The levels of assistance are used by healthcare providers such as occupational therapists, physical therapists, and also speech therapists to describe how much help or assistance a client needs. The levels of assistance we will talk about today will focus on physical assistance, but keep in mind that the levels of assistance can be used to describe cognition as well. Examples of levels of assistance for non-physical categories include comprehension, expression, social interaction, problem solving, and memory. Before we dive into the specific levels of assistance, we should discuss some basics. First of all, the levels of assistance are subjective. What one therapist uses to describe a client may be different than another one. The levels of assistance are the best estimate and clinical judgment of the assistance that the client needs. Second, the levels of assistance help to simplify our lives. To be more descriptive, sure you can say that a client needs, say, 31% help, or if they cannot help much at all, need 95% help, but it would not be very effective to spend our efforts estimating exactly what percentage of help the client needs. Also, remember that since the levels are subjective, one therapist's interpretation of 31% could be another therapist's 41%. Therefore, therapists and other healthcare professionals estimate the percentage of assistance and round them to 25% increments and translate them into descriptions. These levels of assistance describe how much help someone else besides the client provides, but can also be thought of how much the effort that the client puts in. However, the sum of the two comes to 100% between the effort that the client puts in and how much the caregiver provides. Let's go over these levels of assistance. To remember these easily, they are divided into quarters, so 0, 25, 50, 75, and 100. The most trouble I had with the levels of assistance was wrapping my head around thinking in terms of the OT, or the effort made by the client. I'll be explaining in terms of how much help the OT provides, hence the term levels of assistance. However, some rehab measures such as the Functional Independence Measure, or FIM, or the new care tool section GG used in rehab, such as acute rehab, may define these levels in terms of how much effort that the client puts in. So it depends on the measure that you do use. Independent is needing no assistance. This is zero help needed. Client performs everything, or 100% of the effort. Minimal assist is needing approximately 25% assistance from a therapist or caregiver. Client puts in 75% of the effort. Moderate assistance is needing 50%, so the client puts in about half the work. Maximal assist is needing 75% assistance, so the client puts in 25% of the work. Total assistance is known as dependent, or needing 100% assistance. Client is unable to provide any assistance, or 0%. See how this simplifies things by using descriptions and a range broken down into quarters of 25%? Of course, the OT never really assists the client in exactly 25% increments. They are just rounded to that to simplify things. While we normally don't think in terms of percents other than 0, 25, 50, 75, or 100, it can be broken down further actually. Sometimes therapists such as OTs need to get more specific, such as with scoring showers. It's kind of like how you score the rule of nines for clients with burns. For example, with showers, the body is divided into segments like the rule of nines, representing 10%. OT would see how much assistance that client needs for each body part, add them together, and reference to the table to come up with a description of how much assistance they need. I'll keep things simple and discuss the levels of assistance in general terms. Just keep in mind that levels of assistance can be defined differently depending on the rehab measure you're using. For example, the Functional Independence Measure, or FIM, uses a different scale for these percentages, so it can be confusing. Many therapists, including me, get FIM mixed up with the general levels of assistance. Why? The percentages and levels don't exactly line up, so just be aware of that when you're talking about the levels of assistance, whether it's speaking in terms of 1, general terms, 2, FIM, or 3, the new care tool, section GG, implemented by the Impact Act, because there is a difference in the scale and the descriptions that correlate to them. Independent is still 0% assistance, so no change there. With minimal assist, the OT provides 1 to 25% help, or another way to think of it, the client provides up to 99% effort. Remember, if the client provides 100% effort, they're still independent. With moderate assist, it's about half-half, but more specifically, the OT provides from 26 to 75% help. The client would provide about up to 50% effort. With maximal assist, the OT would provide 76 to 99% assistance. The client would provide up to 25% effort. Dependent would be absolute and is 100% assistance. Again, the client provides 0% effort, so no change there. So as you can see, it can be pretty straightforward, but it can also get pretty complicated. By the way, did you know that there's a OT Dude podcast? Check out the pod quiz episode on levels of assistance to quiz yourself on this knowledge. I'll post a link in the description below. You should know that there are some additional levels of assistance used in therapy and the healthcare world. Let's start with supervision. This means exactly what it sounds like. A client needs to be supervised in order to be safe. However, the therapist offers no help or 0% assistance to the client. Just like at work, how supervisors may give you reminders to do work-related tasks, therapists may provide cues to the client in order to stay safe. An example of verbal cues may be stand up straight or hang onto the grab bar so that you do not lose your balance while you take off your shoes. Supervision is sometimes called standby assistance. What if you're unsure about a client and want to keep a hand on them but not offer any actual physical help? Say you want to hold on to a client by their gait belt, but if they lose their balance, you're right there to help and react right away. Therapists call this contact guard assist. Some other levels of assistance you may hear are 2-person or 3-person assist. For example, if an occupational therapist co-treats with a physical therapist to work with the client, they may be considered a 2-person assist. As each therapist may provide their own level of assistance though, say the OT 25% and the PT 25%, it can get a little bit more complicated. One way to document this is to add the two together so that 25 from each adds up to 50, or 2-person mod assist. By adding the additional 2-person description, the team knows that the session will require an extra set of hands for the next treatment session. In the same role of needing a lot of help, if a client is dependent and needs the therapist to do all the heavy lifting, do they really do it? Well, they theoretically can, but they should not do this over time in order to prevent injuring themselves. Because you can imagine lifting a client who is dependent or total assist is essentially dead weight, you could also risk injuring the client if they fall, as well as others, such as the staff. So instead, if clients are dependent, some facilities, such as nursing facilities, require staff to use mechanical lifts, such as ceiling lifts or Hoyer lifts, with the sling to move clients from surface to surface. As they progress and become stronger, therapists can then take away mechanical devices and assist as needed physically. They also play an important role in training caregivers how to use these patient lifts themselves if a client were lower level and not expected to progress in their recovery. What if a client refuses to do any activity like getting out of bed or brush their teeth? That's easy. You would just document refused or activity did not occur. In closing, therapists and healthcare providers use the levels of assistance in their everyday job. It is in their therapy language to describe clients with their level of assistance. One rewarding aspect of OT is seeing clients progress in their levels of assistance in their daily functions, such as their ADLs. Levels of assistance allow OTs to look at discharge planning from a bottom-up approach with each component activity. When you take all of these individual levels of assistance, say how much assistance for brushing teeth, how much for getting dressed, how much for taking a shower, you can take a holistic, broader look at the client and help determine if they are safe to go home. So OTs can look at a variety of levels of assistance for a client collectively to come up with a discharge planning decision. That's it for this episode on the levels of assistance. To test your knowledge, don't forget there's a pod quiz episode you can listen to on the podcast. I'll post a link below. Don't forget to subscribe and thumbs up. I'll see you in the next one.